Let's talk about death toll. The death toll in the past several weeks in Thailand has been at 40, 50 up, and that is a lot compared to last year. However, a forensic doctor at Ramathibodi Hospital of Mahidol University has observed the number of deaths from the COVID-19 reported by the CCSA in its daily briefing. He said that it could be higher. In his Facebook post today, Assistant Professor Dr. Samit Sison, Chief of the Forensic Laboratory in the Department of Pathology, wrote that the situation is really severe. The numbers of patients and deaths seen were definitely not the actual figures. The doctor cited a swab test on 4 victims who were sent to his forensic lab for examination to determine the actual cause of their deaths. He noted that 4 cases were in just one day, and the victims came from areas which are within the coverage areas of Ramathibodi Hospital. Dr. Smith also said that most of the death came from congested areas in Bangkok, such as National Housing Authority apartments, where several tenants were reported to be infected, but they are not being admitted due to the shortage of hospital beds, adding that several of them could not even get COVID-19 tests. He cited the case of a bed-stricken patient who was infected by a family member and was totally unaware that he was infected until the dead family member was found to be infected in a posthumous test at the hospital. The doctor thinks that many people in slum communities don't know who among them is already infected because no authority has looked into their problem. At Ramathibodi Hospital, where free COVID testing is still being provided to members of the public, Dr. Smith said that he saw many people showing up at the hospital from 10 p.m., from 10 a.m. to queue for tests. Actually show up a night before to queue up for the following days. He admitted that even at Ramathibodi Hospital, forensic doctors could not conduct swab tests on all of the dead victims because they could not ask for a refund for their costs from victims who died before their arrival at the hospitals. Speaking of the figures, higher than this or not, let's take a look at what the CCSA reported today. Thailand recorded 6,519 new COVID-19 infections and 54 more deaths today, raising the total since April to around 272,000. At the same time, 4,148 patients have recovered from the disease. So we can see the trend here. The new case found still a couple thousands more than the recovery cases each day.